So all those things you said, don't say it.
If I'm working with someone who has depression, how should we properly, we not interact with this person?
Yeah.
Do we try to engage them and always get them on when they're on a high and then leave them alone when they're having those episodes?
Well, I think it depends on how much you want to help, right? Because, and this is something that I caution everyone that I see, and they say, hey, I really want to help. I've got a friend or a family member who's going through a hard time and I really want to help them. And I tell them, yes, but do you want to help or do you have to help? I think there's a really big distinction there. Because there are some people with that Superman syndrome where I have to save everyone around.
That's what's slightly narcissistic as well. That's another disorder right there, right?
Another topic for another day, I suppose. Right? But that's important because then it will help us decide how we can help this person, right? So let's say, I want to help this person. I care for this person, he's a really good friend, and I want to make sure that he's okay. So in those kind of situations, I would suggest that you just do things with them, right? Go out for a coffee, go out for a beer, go and watch a movie, go jungle trekking, go skydiving together. Just do activities with them. That's actually the lowest hanging fruit that you can do for someone with depression. Because it's always a cycle, right? I feel crap. Then after that, I recluse myself. I don't go out. I stay at home. And because I stay at home all the time, I have a lot of time. All my thoughts are idle. I'm thinking about all these horrible things about myself. No one likes me. Everyone ignores me. I feel even crappier, right? And then I stay at home even more. So this is really bad vicious cycle that happens, right? So the easiest thing that you can do is to just get them to do stuff, right? Go out and watch a movie, go and play some football, futsal, whatever it is, right? And you break that chain. It's the easiest thing you can do, right? So the first thing that you can try and see it for a friend. Another thing that you can do is just listen them out, hear them out, sorry. And the reason why I say that is because our minds are fantastic things at creating fantasy scenarios, right? So if I ask you, for example, what do you have for your last birthday? Can you remember? You remember that, right?
Kinda, yeah.
And if I ask you what do you want for your coming birthday, like how would you like to celebrate? You can let me know what you would like. You can imagine.
PS5, sorry. Okay, just throwing it out there. Sponsors? Okay.
Me too.
Yeah.
But because of that ability, right, that allows us to think about aeroplanes and laptops and microphones and all that kind of things, it also creates a situation where we can amplify negative thoughts, right? So from, oh no, my boss sent me an angry email to I'm going to get fired, to I'm going to die alone in the gutter. No one's going to care about me.
Just from an email.
Correct. And that's the same fantastic ability that our brain has to create fantastic scenarios, right? From a microphone and airplane, it's not that big a difference from getting a bad email to I'm going to die alone, right?
Right.
The same kind of system in place, right? So if you're able to just speak to this person and let them sound out their thoughts, right? It's like a pressure valve in that sense. You stop their thoughts from growing bigger and bigger and bigger, more compressed until they explode, but they give it on little bite-sized chunks. So they tell you, hey, you know what? I got an angry email. I think I'm going to get fired. You as a friend coming, you don't be crazy. He sends out 10 angry emails a day and gets fired, right?
Yeah.
And then he goes, oh yeah, that's true. So you kind of temper out his thoughts a little bit.
Are we allowed to say stuff like that? Because I always worry about saying the wrong thing. I worry about saying stuff like, I know exactly how you feel. Because I don't know how the fuck you feel, right? Because you're doing something completely different from me. Do I say, it will pass? Are there things that we shouldn't be saying?
That's actually a really good point. So all those things you said, don't say it.
Right.
Because it's you're using your own reality and experiences and then trying to implant it into him.
Yeah.
Which is not fair, right? And we talked about perspectives as well. What you find blasé and okay about might drive him nuts.
Yeah.
What he finds okay might drive you crazy in that sense, right? So if you want to have that kind of conversations with these people, right, who are going through a hard time, talk facts, right? That's fine. So like, for example, boss sends out angry email, he gets triggered. We know for a fact boss sends out 10 angry emails every hour.
Right.
So those are facts. So you just tell them that, hey, this is what's actually happening, right? So you don't try and impose your own reactions or experiences onto these people who are depressed, for example. Instead, you tell them, hey, this is actually what's happening. This is the reality. This is the factual situation of it, right? And then they get to decide on their own. Now, is this going to work 100% of the time, even with the behavior, the behavior activation?
Yeah.
It's not, right? 9 times out of 10 it's going to work. The other time it's not going to work. And that's the reality of the situation. Even with therapy as well. Even though I know my techniques work, it's not going to work all the time. But as a lay person, as a friend, as a co-worker, as a loved one, that's what you can try and do. Go out with them, speak to them. The last thing that I would advise that you do is, if you don't know what to do, if you've heard them, you've gone out with them every single night for a month and you're just completely stuffed, I don't know what else to do anymore.
Yeah.
The next best thing you can do is that, hey, you know what? I found these 5 centers that I heard and I've done my research on them. They come highly recommended. They're really good people. Let's go together.
Right.
That's the next best thing we can do. Because I wouldn't ask you to do any more, because if not, what's going to happen is that you're going to get bogged down as well. You're going to feel bummed out. And then instead of one depressed person, you're going to have two. Right? It's going to be...
Because I'm going to get affected.
Exactly. And it's very natural. Even as therapists as well, right? We are encouraged to have our own therapists because we sit in a room all day and listen and absorb everyone's negativity. There's no way in heck that you're not going to get affected.
Hey guys, thanks for watching. Glad you liked it. Now, if you want to check out a full discussion on all our other episodes, click right here. And of course, don't forget to subscribe.